So hello everybody and welcome to Twitter Data Analysis for Digital Health Research. My name is Joseph Allen and I'm a research associate with the UK Data Service at the University of Manchester, and today in collaboration with N8CIR. So first of all, as with the self-seeking theme of social media data, if you are on Twitter, feel free to follow me there. I do tweet a lot of stuff about this kind of stuff. I did a whole thread yesterday about COVID data, basically summarizing what we're about to do in this talk. And also, if you do have any questions, you can email me at joseph.allen@manchester.ac.uk. And I sadly have to start this talk with a word of warning. Obviously, we're about to grab some real tweets from the real internet, and that means that sometimes the tweet that I get, for an example, has the potential to be very sexist, racist, homophobic, or generally awful in a bunch of other ways. All I can offer is apologies if those come out. I may read them, I may not. It depends, but it's not my sentiment, it's the Twitter users, and that's arguably their fault, but we'll get into that later as well. So over the next 60 minutes, we're going to cover generally what social media data is and why it's useful from any social science perspective. We'll go further to talk about why Twitter in particular is my personal favorite. And then we'll go through some cool getting started project ideas in the sort of health space. That'll take about 20 minutes. I'm going to skip all the coverage of ethics and the less technical ways of accessing Twitter data. So I'm hoping that you're all maybe a bit interested in Python, but at the very least, I've set up some binder links and stuff. So even if you aren't, you should be able to run some of the code if you want to. And finally, we'll go over to the command line where we're going to use Twark. So that's how we actually grab our data. That's going to take about 20 minutes. And then I've got a 25-minute demo where I'll just show you what we can do with some Twitter data. And there's some data I've provided of all the tweets containing the words cough, coughing, sneeze, and sneezing, and things like that from the last 3 months. So you can play with that on your own time too. So to start with, let's talk about why any social media data might be worth collecting. Social media is one of the first times in history we've had such consistent access to what I would call the individual. When we try to represent this individual, it's usually done by listing relevant facts about that person. The term I use for this is facticity. It covers who this person is, maybe right now, probably sometime in the past, but none of their potential in the future. We might, for example, have a data set of names, ages, sex, number of siblings, salaries, and other personal health data. This set of data is very useful if we want a snapshot of a demographic at the time of collection, but 6 months later, our analysis can already be dated. Data collection on the number of staff working from home was very different in 2019 than it was in 2020, for example. Okay, when we collect data on individuals, we make a lot of assumptions. We assume that that data is recent. We assume it's recent enough to still be relevant. We assume an individual didn't lie to us, perhaps covering up any societal flaws. You know, they might suppress their drug use. They might be concerned about being overweight and might underestimate and other similar features. We assume that individual isn't actually in denial themselves. They might have some sort of dysphoria, some disconnect between their body and who they are. They might underestimate how often they break a law, how often they drink alcohol, how many cigarettes they have, or they might even secretly want to have COVID symptoms to attract some attention. This is probably more likely to be happening on social media. There may be some sort of hypochondria going on, and these users might constantly self-diagnose themselves using strange tips they see on TikTok or Twitter. And also, we always assume that the events outside our data set can be ignored if we can't track them, but obviously we've seen over the last 2 years how dangerous that can be. So imagine we did have a user with perfect health data. We've got every time they've spoken to a GP, everything. If in that data set, that user had no information or there was simply a label that said their health was healthy, would you believe that as a data practitioner? Is that something you'd expect to see? And while the label may say healthy, they could be currently having a cold, right? 2 weeks after that data is collected, they might have gained some weight. They might have been stress eating. There might be some bad situations going on in their family that might trigger some IBS or something like that. Or they might have just had one very, very unhealthy meal. None of that is going to be explained with a traditional data set. And even with that perfect health data set, we still cannot tell whether this individual will continue to be healthy tomorrow. The user may interact regularly with those healthcare services, and these may keep unified records, but the best we can do is just make statistical assumptions about what to do for them next and what they might be at risk at. And at any moment, this can be interrupted by a surprise illness, an accident, or a pandemic. And this is where social media data will grant us access to the data set that we always thought we wanted. Social media can be defined as technologies that allow the sharing of information via virtual communities. It's no secret that today many people share facts about themselves freely with other people, academia, businesses, and governments multiple times a day. They may report health issues publicly on social media data long before they even engage with a healthcare provider. It's easy to see why this might be useful to researchers or industry. Users may identify incredibly sensitive health data publicly or may even wear some of their health issues as a badge of pride. This creates a very valuable data set with very ambiguous ethical concerns. Again, we probably won't go into in this talk, but there are recordings of me talking about Twitter ethics over on the UK Data Service YouTube channel. Without social media, a human could seek to answer these questions the same as we always did. We can speak to them. To figure out if someone will be healthy tomorrow, we don't need machine learning. We can communicate with them. We can make use of language, recognize body language, ask follow-up questions. Social media data basically brings us closer to this conversational approach with all the complexities of managing that conversation, which leads us to the next big question. Why Twitter? Why not any other social media? So enter the tweet. With a 280 character limit, we normally get very succinct messages. These tweets usually make sense without needing outside context, though they might be in sort of a reply thread or a reply to somebody else's comment. Because they're so short and detailed, their sentiment and topic focus is usually very, very clear. Their content is quite easy to scrape with web scraping technology because the social media itself is quite simple, and Twitter offers their own modern API for more complex searching. Tweets are considered qualitative data as their natural language, but increasingly natural language processing is entering that domain of quantitative analysis, basically. And with individuals willingly publicly stating their views on things alongside geolocation and timestamps, you can understand why this might be highly desirable. And Twitter tries to facilitate this sharing. Remember, Twitter is a marketing platform and the users are the product. They want you to find it valuable, easy to use, and to encourage you to share how you feel. So this is great news from a social science perspective, but maybe not good news from a societal perspective. So what are the disadvantages of Twitter as a data source? One is that the open source packages that make collection of data so simple are competing with one of the world's largest corporations and the speed with which their technology changes. These packages are frequently out of date with the newest features. It's also said that Twitter is marketers talking to marketers about marketing, and a lot of the content is very self-promoting or even commercial. And we need to take this into account when using Twitter data as the foundation in any project. For example, if we just look for the terms COVID, we'll find a lot of big brands have obviously been talking about COVID for the last 2 years. It's not all individuals talking about COVID. The user base of Twitter also introduces its own bias. The users only represent some people who have access to the internet. Most users are around 24 to 35, 70% of them are male, and 80% of the tweets come from 10% of the users. So only you can decide how this bias will affect your work. That being said, Twitter does have some great benefits. Each social media has the ability to set the barrier to entry to scraping their content. Some try to make it very, very difficult, like Facebook, for example, but many now offer an API to anybody with a valid academic reason to access their data. In this regard, Twitter is probably the most accessible I've seen. There are a handful of pages which make it easy for developers to collect Twitter data. Twitter has an academic tier to its API that I'll go into more detail later, and that allows the collection of 10 million tweets a month. Generally, Twitter receives a small amount of controversy compared to the other social medias, swinging elections and installing spyware and things like that. It tends to be quite stable. The character limit also reduces rambling and collects very focused content. So in this section, I'll just cover some cool starter projects if you did manage to grab some Twitter data. Cool project number 1, I recommend trying to collect all the tweets from a single location and see if you can visualize the growth of a classic winter flu or a new COVID strain if you're not tired of hearing about COVID stuff. Can you predict when the peak will appear or what the lag is between the peak of chatter about the symptoms and the peak number of cases? We'll be doing this in the final code demo as well. Project 2, illness word clouds. It doesn't sound very fun. Word clouds are a pretty rubbish visualization tool, but they do usually get very good attention outside of academia. They fit very well into any promotional or narrative material. And personally, I think they're quite fundamental in communicating with policymakers. They also look quite cool. So you could, and we will, look at the words associated with particular symptoms of COVID on Twitter. And if you could take a network view of that social media data, you'll probably find clusters of similar conversations. So you'll be able to find conversations relating to symptoms, relating to maladies. You could track a user's recovery over time, or you could even track the spread of talk about vaccinations or successful spread of vaccinations on social media. So next we need to ask ourselves, is it ethical to use social media data? If you're more interested in this, I've got like a whole half-hour YouTube thing I did over on the UK Data Service channel, so you can look at that. And there's a 5-part blog post now as well. But I'll just skim over this. So we would be so preoccupied with whether or not we can access this data, and we're given permission to do so, we often don't think whether we should. Some arguments for being able to use Twitter data are as follows. This data is public, and we all know it's public, so we shouldn't need to seek any permission to access it. Any user posting content they are ashamed of should have known better. This is the internet. It's bound to come back and bite them. This data set is too valuable to ignore. It contains a wealth of opinion data on politics, company values, societal trends that we just can't get anywhere else. And there's no privacy concern. As we say, it's public, so we can ignore GDPR. On the other side of this, I argue we probably shouldn't be allowed to use Twitter data as it stands. It should require some intervention. Just because it's public doesn't mean all users treated Twitter as a public data source. While their intentions may have been wrong in that regard, that doesn't mean consent is a default option. We could ask some users some further questions. Do you think children know how their data will be used on Twitter? Did all users anticipate the uptake of machine learning, targeted advertisements, and political manipulation that's only been possible thanks to social media? And are we bold enough to claim that we are through the worst of the misuse of this public data set? There's also the question of informing users their data is used. Many users feel that their content is largely unobserved, and it's this data that we seem to be okay with using. If we reached out to these users, I wonder how many would feel disgust knowing their content is used in this way. Beyond talking about ethics, I'd argue that a tweet's contents are sometimes unique, and as such could uniquely identify the individual who created them. The justification that this isn't a problem is again that the data is public, but I think public and observed mean very different things. In a more traditional study, we would give users the right to revoke their data from the study, but we don't offer this option to any social media study. How can we give users the right to be forgotten and withdraw from studies that they don't even know they're participating in? And further, whose responsibility is this? So at this point, Twitter data has already been used or mentioned in 500 studies at the University of Manchester, so a precedent is already forming here. On the other hand, universities like the University of Warwick have decided that projects which make use of social media data may require an ethical review in some cases. Data being publicly available is arguably not justification for its unaccounted use in research and in business especially. Users have no idea how often their content is scraped or to what ends it is used, and would probably be quite upset if they did. Users have very little anonymity in this process. Their personal name and location can easily be scraped from Twitter, and a large portion of tweeters can be re-identified simply through Googling the Twitter text. Some very clever disclosure control would need to be used to get around this without fully polluting our text dataset. As users weren't contacted, they have no ability to withdraw from studies. And if they could withdraw from studies, how would we manage that when we're grabbing 10 million tweets? Who would even be in the position to solve this? And again, I'd argue Twitter is, and you can see more about that in the UK Data Service talk. Cool, so next we'll talk about the Twitter API. You've likely heard the word API before. It stands for Application Plugin Interface, but I don't think that's ever been useful when I've mentioned it. An API is basically something that lets us access data from a source that without the API, we would probably never have access to. Usually we access these APIs through a helpful user interface designed by the people who made the API, such as a website, a mobile application, or a kiosk. But when we need to interact with them directly and sort of use functionality that isn't available on these public sites, we basically have to build that app ourselves. We could consider an API the waiter in a restaurant. They give us access to what we want as long as we play by their rules. Instead of engaging with our waiter through a website or mobile phones, we usually order items off a menu that they've given us. And we know that we can't really break these rules. We can't ask for food necessarily that's not on the menu at all. We can communicate things like allergies and additional security concerns. And then instead of working with the database, our waiter then communicates with the kitchen to deliver the content that we're requesting. APIs control how we access most of the web. It handles all login and sign up, as well as the distribution of private messages. Twitter shouldn't be giving everybody access to all the data all the time, and their API is how they regulate this. You wouldn't want one user to be able to read another user's private messages, for example. Every social media gets to choose how secure their platform is, and as such, sometimes we have to handle various authentication protocols to get access to what we need. So how are we here talking about the way basically the entire web works? All we wanted to do here was collect a couple of thousand tweets for some research or for some investigatory projects. I'm frequently overwhelmed by this point. I think we ask way too much of academics to sort of learn all these fundamentals, to scrape these tools. It should be easier than it is. But without this web security, we wouldn't have access to this data at all. Without the ability to lock those doors, we wouldn't construct the buildings. Without the waiter in that analogy, we can't even open a restaurant. Guess everyone has to cook at home. So back to Twitter. The Twitter API is made up of various endpoints which expose data and methods. It's very likely that the version of Twitter that we use as users is a tiered version of that API. With this API, we can look up individuals, tweets, search recent tweets, and we can stream tweets in real time. Using the free tier of this API, you can only grab data from the last 7 days. If you pay for the premium or the enterprise tiers, you can grab data in the last 30 days. And further to this, the Twitter website obviously holds all the tweets from all time. So with some clever web scraping, you could get beyond this 30-day limit. But as of August 2020, we don't have to. Twitter has introduced a new academic tier. Academia generally makes better social good use of data than the industry does. And our options have been to either use that free tier to only get 7 days or get creative with web scraping methods, basically. So this gives us access to Twitter's full archive search. I believe we can get tweets from all the way back in 2008. And this fantastic resource saves us learning all those usual workarounds, but your project must be non-commercial and you will have to justify your need for this data and prove you're an academic through Twitter's review process. Playing with Twitter, the Twitter API directly requires quite a strong programming background. All these APIs do. And through the tiered API, we can access, as I said, last 7 days. But as an academic, we can get 10 million tweets from any period of Twitter's history a month. So if you want more than 10 million, you'll have to stagger your work or you'll have to work in a group with other people who have access to the API. But we also need to understand how to access those API keys and manage them and use them, which I'll go through in the next demo, which is right now. Okay, so in this notebook, what I'm going to do is basically walk through from nothing how you get your Twitter API keys, how you grab some data, very specific data. So you can say like a start time and end time, a location and terms that you're going to search for. We've talked about most of this. The main package I'm going to be talking about here is one called Twark, which I'll link, and I'll link this notebook here as well. So if you use Anaconda, you'll be able to download this repo and use this notebook. If not, the tool we're using is actually a command line tool. So you'll have to figure out some way of getting to the command line. But as I say, this all exists on GitHub anyway. You don't need to follow along now if you don't want to. And again, Anaconda is my recommended way to access that command line if you're not too familiar with it. So in order to install it, you will need Python installed on your machine as well. So you can check that just by typing Python into that. Oops, you can't type it. Terminal, sorry, not console. Right, so if I navigate to this folder. Okay. Let me go back to there. So you can check if you've got Python just by typing Python, and that should bring up what's called a REPL with these 3 arrows. You could type 3 by 3 plus 3 and it'll give you those mathy answers. So that just means you have Python on your machine, and you can leave that by clicking Control Z. You will also need pip3, but if you've got Python installed, you probably have that, and you should see this manual page of sort of helper tools. So once you've got them, you can install Twark. You can check if you've already got it. Again, you can just type Twark and you'll see the manual page, but you probably won't have that by default, even though you might have Python and pip installed. So you can either type pip3 install Twark over here to install it, or you can run this cell in the notebook and that will install it in your Anaconda environment for you. So now we've got Twark. Twark gives us access to what's called the version 1 API, which doesn't have the academic tier. So we need to move to the V2 API. And again, this is off the back of me trying to figure this out for weeks and weeks. You can ignore that. You just need to make sure you have the most recent version of Twark, and you will have access to Twark 2. So again, you could test this just by typing Twark 2, and you should see a manual page. If you don't see that manual page, you can run this cell and that will upgrade Twark to the most recent version. Now we've got an annoying bit. So this is the Twitter developer portal. So this is what you'll only get access to if Twitter approves your access to the API. And you should have 2 tiers. You can see, let me zoom in a bit. You can see I've got this academic project up here, and I've got my elevated project down here. I don't really know what that is. So what you'll want to do is when you've got access to this, and it might take a few weeks to get access to the academic tier, you'll have to, have a back and forth with a Twitter employee. You probably have to show somewhere on the internet that you are an academic, maybe a Google Scholar link or something like that. But in here, I'm just going to add an app. I'm going to create a new app, and I'm just going to call it N8 Twitter demo. This will expose some keys and tokens. These are very secret things that you shouldn't share with anybody. If I give you all these, you could tweet from my account and things like that, but I do need to show them to demonstrate this process. So I'll try and keep them fairly quiet and limited anyway. So if you type over here Twark2 configure, it will launch this little helper tool that's basically supposed to make this part easy for you. So it asks for your bearer token, so you can copy that, paste it there. Asks if you want to add those API keys, which I do. Copy the API key. Copy the API key secret, which is what it's asking for next. And then it will ask how you'd like Twark to obtain your keys. You can manually enter them, but if you press 1, it'll give you a link you can go to. And then that link will have an authorization page and then a pin, which you need to copy. Again, this stuff like a year ago was a total nightmare, but Twark makes that all really easy. That all looks very complicated, but imagine figuring that out without somebody asking you those things. That's what it used to be like. You had to sort of write them in an object like this, and it was very unintuitive. But anyway, now we have Twark, so you can see it says happy twarking. So now I can just at this point start asking for things. So we've got Twark2 is our command, I guess. Search is sort of the command we're using within Twark2. So I want to hit the search API. The archive flag is going to say, preferably I want stuff from the archive if you can give it to me. I want a limit of only 100 tweets, and I want to search for the keyword cough, and I want to write this to 100 cough JSON. And that should run really quick. 100 tweets takes no time at all. So you can see there, it processed the first 9 minutes out of 15 years, because if I didn't put that limit in there, it would have run to collect all 15 years of cough data. And now in my health demo, I have that JSON file. So it's not particularly useful. I don't know, JSON is a JavaScript object notation. So again, if you're not a JavaScript person, this probably won't look too familiar to you, or if you've never programmed before, this might just look like a big mess. But that's why I'm going to try and get away from the JSON notation very quickly and show you how to do that. But what we can do here is we can grab the ID from that. And if we go to Twitter and go to any tweet, so if I look at one of my tweets, in the URL up here, we can see a person's name, status, and a number that looks like that ID. If we paste that ID in there, it will take us to that. Okay, so this one has come up perhaps because somebody here has said cough, cough in the chat. So we have found a tweet that relates to coughing, though it's not a tweet I'd like to show on the screen for too long. And that's what the warning was for. So yeah, let's break that request down. So as I said, Twark2 is using Twark2. We're hitting that search endpoint. We're asking for archive data, though I'm not going to check with, maybe I'll have a look in here when it was created. But it was probably created very recently. So that tweet came today, literally 2 minutes ago. So what Twark has tried to do there is it knows that the archive search is probably the last bit you're going to want to search. If you were a free user, you wouldn't have access to it. So it's just trying to give you from now backwards instead of from the start of your search onwards. So that's something to be aware of. You have to basically set a limit if you're particularly looking for an archive search. As As I said before, you get access to 10 million tweets a month as an academic. We obviously didn't hit that because we only asked for 100, but you could very easily hit that perhaps if I asked for all 15 years. And I'm pretty confident there that we do actually have tweets about coughs, just because I saw coughing, though they weren't particularly related to any healthcare issue, but that's something we'll have to deal with as well. We can also read that in using Python here. So that just reads in the entire data frame. You can see that a lot of these columns basically contain more of those JSON objects. So you've not really got what we'd call like a flattened data set. But we do have a lot of stuff in there. So we can see all the text people have written. Why do kids cough like that? If you've had COVID recently. So it seems like we have captured some tweets about coughing. I've gone through the Twitter URL format. So next thing I suggest we do is install the plugin Twark CSV that will get that away from JavaScript notation. So again, you might have to upgrade Twark. You might have to configure Twark too, but we should have already done this at this point. Next, we need to install Twark CSV. And again, you can either paste this in your command line, or you can run this cell if you've got Anaconda. And now we'll be able to run Twark2 CSV, name the JSON file, and name the destination CSV file. We can also use something at this flag called no inline reference tweets. That will get rid of any tweet that's in reply to something else. So what you might have is one celebrity might tweet about their cough and their COVID, and then thousands of people will reply because they want to talk to Boy George or whoever it is. This will remove those tweets. So as an example, that will convert using Twark2, using the CSV plugin. It will convert our JSON file into a CSV, and it should remove any time people are sort of replying to tweets and retweeting and stuff like that. And again, only takes under a second, past 100 tweets, and now it has written them to a CSV, 100 cough CSV. And this one's, again, Anaconda will facilitate opening this. You can open this file in Excel. You probably wouldn't be able to do that in JSON without some help. And we can see in here, we've got a flattened object. So now we've got the IDs have their own column. We've got, the text in its own column, the language of the user, the number of likes, retweets. We've got author information. There's loads of stuff. There's about 75 columns in there. Even tags sensitive tweets for you. And again, much easier to read in to pandas if you are a Python user, or into R, or wherever you want to use it. It's probably too big to look at here, but if we call data frame info, we can see all those columns, and we can see just the wealth of data we've got there. So as I say, we've got all the metrics, we've got all the hashtags people have used. We've got a flag as to whether it's sensitive. If you do want to particularly look for sexual or racist or sexist content, that flag might help. Political content as well will come under that. All the author details, when that user created their account, their profile picture, their location, and we've got all their geolocation as well. This one's a bit iffy. Only 1% of users actually have geolocation turned on. So it's quite rare that you'll find tweets that actually contain that. Okay, so it's not enough that we're simply just going to search all the tweets. Instead, let's do something a bit more related to healthcare. So I've talked about, so the thing we're going to do now is try and grab data from the Omicron emergence over the holidays. So from September to the end of December, and just see if we can predict that rise or do anything with that rise in COVID cases. And one point to make is, how useful is that 10 million tweets? Just as a previous attempt, I tried to grab all the tweets containing the word vegan worldwide in January 2019, and there was about 1.2 million tweets. It took 32 hours, and there was about a 5 gigabyte file at the end of that. There are about 500 million tweets made every single day. So it's very important that you narrow the scope of your project, and also ask yourself, if you did have 10 million tweets, what would you even do with it? It's quite hard to manage analysis on 10,000 tweets, let alone 10 million tweets, let alone 500 million. So you probably won't be coming in and just saying, hey, get me all the tweets that contain the word coughing ever. You might have to be a bit more specific than that. Luckily for COVID symptoms, there's less of a marketing push. Most companies aren't advertising with the word cough, but a lot of them did advertise with the word vegan. So my hypothesis here, do self-reported symptoms on Twitter predict a COVID wave? And I'm going to need some general Twitter data here. So we could just type this, Twark do search cough JSON, and that will grab all of the coughs that Twitter has from the last 7 or 30 days, depending on our tier. I'm not going to run that because it won't run in a reasonable time. It could take hours. So instead of that keyword cough, we don't just want the keyword cough. We probably want words like cough, coughing, and coughed. They'll all come up differently. Just searching cough won't do that for us. So this is how you can sort of connect those with different operators. And there's a page here that has all of the various operators you can use, but there's loads of stuff in here. There's, you can get hashtags, you can get emojis, all sorts of stuff. But for now, we just need or. So I'm going to search for cough or coughing or sneeze or sneezing or headache or fatigue and put that in my file. But again, I'm not going to run that because it will grab all of those from the last 7 days worldwide. It'll probably be too big. So the next useful thing to do is add this limit. So this limit flag lets us set how many we want. So this one is actually safe to run. So that will only get me 100 tweets that contain cough or coughing or sneeze or sneezing. And it'll write those to my 100 coughs again. So I should just be able to grab this one and have some confidence that it's got one of those words or the person has that name or something like that. Ever just sneeze your snot out and the second you breathe back in, it goes back in your nose? Very relatable. So yeah, we are grabbing the correct data there. So that's how we would limit that search. And we don't have anything there that, says this person is from a particular area. We don't have any consistency in this data set other than that they should all be using one of those terms. Next is the archive flag. So when we got that tweet was probably only just from seconds or minutes ago. Yeah, literally 1 minute ago. So it will start with the most recent tweets. In order to get more than that, we need to ask for the archive, particularly. Oops. So if we search this, we would get the exact same thing actually, because we'd only get the 100 most recent ones, which is why we also need to add the start time and end time flags. So that's what we have here. So breaking down this, we use Twark to hit the search endpoint. We request permission to use the archive search because we can. We only want 100 tweets, but I'm going to set the start time to be September and the end time to be January. So this way we are definitely, probably for the first time, actually hitting the archive endpoint. And you can see there it was scraping 2 months. What did I call that file? 100 COVID 2021. So if we look in here, we've got a Twitter ID again. So this one should be old, but hopefully relevant. So from December 31st, 2021, ending with a headache. That's all we got. So that's actually the archive search. That's something that we weren't allowed to do literally 2 years ago, but can now. And then adding to that, we can fix the location. This one has always been a bit finicky. I find that, as I say before, maybe 1 or 2% of all users actually have geolocation data associated with their tweets. Normally that's when a phone has it left on by default, or they're using the actual Twitter app or something like that. So this is another layer of bias to be aware of if you're looking for geolocation tweets. They're quite rare to get, basically. But we can do that by adding to the actual search term. This is actually one of the operators, a place country, or we can set a distance from a lat long. I like place country because it tends to give you a lot, if you say I want tweets within London, you tend to get lots of tweets from people that aren't actually from London or might be on holiday or might be visiting London. They're sort of more likely to tweet. So it can be quite hard to verify that the tweets even came from London. But with this, you tend to get a lot of users who have self-described their location as London or somewhere near London, or they're in London. So it's a bit more reliable. So we've built up to basically everything I need at this point. So let's do one last search. So that's hitting the archive. I'm only going to ask for 1,000 just so it doesn't take ages. You can see this one's taking a bit more time. Starting September, ending January, I'm looking for coughing or sneezing, or cough or coughing, or fatigue or sneezing or headache. I want anywhere in the UK is fine. And I'm just calling that 3-month COVID 2021. So it won't hit exactly 1,000, but it'll stop the next time it pulls. And then we can convert that to a CSV. Again, with that CSV plugin, write the JSON file name, write the CSV file name, and get rid of those inline reference tweets if you want to. And now we should have 3-month COVID. Oh no, here we go, 3-month COVID. So again, we can grab a Twitter ID and see if that is, ooh. So what the F is this thing on BBC? Remember when the 4 main channels gave us a headache as to which one to watch? So again, complaints about the headache symptom, but not related to COVID. But the searching seems to be right. Sorry, I should have checked the time. That tweet has come from December and it's from Middleton, England. So we know it is in the UK. Cool. So there's a few useful links at the bottom of this, but I'm not going to go into that just to make sure that we do properly have 20 minutes for the next bit. So that's how we actually grab that data. Next, we're going to just tidy up that data a little bit and rush through some analysis we could be doing with that data. I don't know how many people are actually following along with this, but there is a binder link here. Copy link. So if you don't have Anaconda set up, you can go to this link and the cells should all run. You should be able to actually do the analysis yourself and tweak it. But if not, you can just watch along here. And as I say, it's all on GitHub, it's all recorded, so it should be okay. So this covers the exploration of those 7,000 tweets. In that 3-month period, there's only 7,000. They were scraped yesterday just to make sure if for whatever reason you couldn't get that Twark stuff working, there is a backup data set in the GitHub that you can always use. Throughout this notebook, we're going to basically explore that data, visualize the increase in a term over time, investigate any connected symptoms, and then build a word cloud. That should probably take, I timed it at 25 minutes, so I might cut out something at the end. But we'll see. If you're running it on Binder, you'll need to run this cell because these packages aren't installed for you, but otherwise you can skip it. This is importing our packages. So these are our data manipulation library, pandas, NumPy for some matrix stuff. And these two will help us plot. And all this stuff just makes the plots look nice, makes them look like they're from the UK data service as well. So we can read in that data set that I prepared. We've kind of already looked at this data a little bit, so I'm not going to do that too much. I've shown you how to check a tweet, but that's all written out here if you do want to manually verify any tweets. And one little hitch is that this search API will actually return users associated with those terms. So if we search the term vegan, as I normally am, you will find users called, vegan products, and you might return all those tweets despite them not actually containing any veganism. So we can look here. There is actually one user who has cough in their username. So this is an example, though this one's very weird because not only does his name contain the word cough, but his tweet actually contains the word cough as well. So I don't know if that actually happened or not, but I found that very weird when I was looking. But that can happen sometimes. But with health symptoms, generally people don't seem to be named and identifying with their symptoms, though there are exceptions, obviously. So I'll just read out the first 5 texts, maybe not the first 5, but this will list just the texts. You can read them without looking at the data frame. I sneeze a lot in general. Is sneezing the difference? I had bad shivers yesterday, cold 1 minute, hot the next, bad fatigue, weakness, stiff muscles. So there's loads of symptoms there for COVID, potentially, that I wasn't even looking for. Maybe we weren't even aware of yet. Definitely over 40, had loads of side effects. Working from home, had to lie down for a couple of hours. That's kind of fatigue, right? Didn't have strength to lift arms, joints aching, full body shivers. So that's 2 people or potentially the same person reporting these shivers. and horrific headache, which is what we're looking for. And coughing a few days, done a test, it was negative, never say never. So again, I'd always recommend running data info, though in the binder that won't work for you. We've already looked at this though, so I'm not going to go through that again. But that just shows you the shape of what you are getting back from Twitter. We can also run describe for some statistical information, though there's not a lot of quantitative information in that data set. So all we really get here is, the average number of followers a user has that's talking about these symptoms, the average number of like that mentions these symptoms is getting, and the average number of retweets a tweet that mentions these symptoms is getting. But again, this will be quite heavily weighted, as you can see, by the users that have a huge number of followers. Someone has 250,000 followers, and we only have 7,000 tweets. So that'll really bring up the average. Same with the huge number of likes, huge number of retweets. The average sort of median tweet only really has 1 like, no retweets. So kind of suggests that COVID content isn't good content for social media if you're trying to get more followers, likes, or retweets. Okay, so we've got like 75 columns there, and that's not really useful. So I'm going to reduce it down to just the IDs, the time it was created, the text, some author information, and some geolocation stuff. So that just makes it a bit easier for us to sort of peruse the data here instead of looking at all of that data. And really, all I really care about is the text in most of these cases. But we can see in the location, Leicester, England, Bristol, England, people are sort of defined as being in England or London or Sutton. So I'm quite confident we've got tweets from England at least. Cool, so let's look next at if COVID symptoms have grown. So I have included just the basic COVID data, not a bit, the like official COVID data is what I meant to say, and read that in so that it can be plotted in Seaborn. So we have the case numbers and the smoothed case numbers, just to tell that story of, from October to January, Omicron appeared, and the number of COVID cases shot up at the end of November, all throughout December. And the question I have is, was that replicated in our tweets? And we do see there is some sort of peak happening in mid-October, though I don't know what that was related to or why that happened, and some sort of trough early November as well. So I can read in our Twitter data and group it by the dates. I also smooth it with a rolling 10-day smoothing. And we see a very similar but very exaggerated curve. And you can see at most there's only about 100 tweets a day, but we definitely have a peak in the early month, exactly as we did here. It's not as exaggerated, but there is an exaggerated peak, a slight trough. And then we seem to have at the start of December an early surge in sort of discussion of these symptoms. And this is probably when people were worried about Omicron, right? Before Omicron was so prevalent in the UK. Then we had a little lull, and then we had the actual surge that came mid-December, and that caused the highest number of reporting of the symptoms or discussion about these symptoms that we've ever seen. So it does seem to have some sort of correlation, though I don't know if this is because more of these users had COVID, or because more of these users were more paranoid that they could have COVID, or more worried about the symptoms they were discussing. So we can actually split out those symptoms. So what I'm doing here is just making a new column for when cough or coughing is mentioned, new column for when sneeze or sneezing is mentioned, new column when fatigue is mentioned, new column when headaches are mentioned. And we can see here, I mean, it's a bit, we obviously search for these terms, so this data isn't too useful, but most of the tweets contain the word coughing. About 700 contain the word sneeze or sneezing, about 700 contain the word fatigue, and about 2,000 mention a headache. So the most reported in those searches are coughing and headache. But again, these are what we searched for. So it doesn't suggest that they're the most prevalent, it's just the most prevalent of what we asked for. And we can verify that that's worked. So have we got tweets about coughs? She had a cough. We've got I have had a cough, just a cough. So again, quite interesting linguistics around the word cough there. Some people being dismissive, some people using it to signal that they think they have COVID. For sneezing, we've got I sneeze a lot in general, sometimes for no apparent reason. That might not be related to COVID. It might be, is sneezing the difference? So I remember a lot of people were talking about for Omicron, you're more likely to have a runny nose and sneezing. Again, I'm not the healthcare expert. Maybe some of the people in the chat are, but that was definitely a sentiment going around, and big sneeze maybe. Fatigue, it's been terrible. Fever, shaking, fatigue, swelling, heart pounding. Again, loads of symptoms that we weren't looking for that might be associated with COVID or Omicron. I was shaking uncontrollably, feeling cotton hold, heart started pounding, whole body stiff, fatigue. And I think this is about football, someone jumping on the player welfare fatigue bandwagon. So a little less COVID-y, though it is COVID-y. And then headache, I suffered from pressure headaches for ages, going to sleep with headaches, got really depressed, tried Sudafed from a chemist, took a day or so, but it worked. Don't know if that's COVID related or maybe someone who suffers from chronic headaches. Pressure headaches, question mark. I mean, these two are replying to the same person. COVID, slept, headache gone, aches and pains gone, cough gone, just exhausted. So again, really interesting description of this person who's even tagged they're on day 3 of testing positive. So there's some really good stuff in here. And then all this will just create a separate plot for the prevalence of those terms at different times. So again, remembering what our graph up here looked like with that early peak, trough, late peak, most of that is made up of coughing, which is unsurprising because most of the tweets we scraped were about coughing. So early peak, trough, slight peak, and then peak when Omicron actually was prevalent. Mentions of sneezing really, really dampened. That curve is still there, but there was no surge of sneezing with the mentions of coughing. So maybe people either weren't sneezing or didn't think it was a COVID symptom, so didn't report it, or maybe they just didn't sneeze at all. I don't know. We see the same with fatigue. So it seems like people generally talk about fatigue. Maybe this is a long COVID thing. Again, I'm sure there's people in the chat here that can interpret this far better than I can, but that's what I'm seeing. And then interestingly, the headache mentions seem to sort of correlate with the cough mentions. Again, that surge in October, that surge with the actual Omicron cases. So perhaps this is a more normal symptom of COVID, or it is a symptom of COVID. But again, this is the danger of social media data. We don't really know which one is what people are reporting here. So something we talked about a lot up there is that we've seen a lot of these comments: fever, shaking, swelling, heart pounding, a lot of symptoms that aren't the symptoms I assumed COVID would be reported as on Twitter: the cough, coughing, sneezing. So is there a way we could find these similar terms? So what I'm going to do very quickly is some natural language processing. So you'll have to run this and download the Punkt package if you're on Binder, but I've already got it, so it'll be a bit quicker. This will take all of the text we have and split it on white space, and then it will build up a word list and build up basically our most common words in our tweets. So we can see the most top 10 common words, and it's pretty useless. We've got a full stop, an at character, comma, I, the, and to, and then cough, but cough should be there because we know half of our tweets contain the word cough. So the next thing we can do is remove those punctuation characters. So this line here will remove any non-alphanumeric characters, so anything that isn't A to Z or 0 to 9. So run that next one. Okay, so we've got rid of all those weird punctuations, but now we've got a lot of words at, I, the, and, to, cough, of it in headache. But again, we asked for headache, so headache should be there. A lot of these are what are called stop words, words that potentially don't add anything to a sentence. And natural language processing is very aware of this. So you can download a stop words library. Here are some of those stop words: I, me, myself, words that, they might add pronouns or some context to a sentence, but they don't actually change the meaning of the sentence. And again, there's a line here that will remove those stop words, and we can see the top 10 words. So now we've got cough, headache, HTTPS, coughing, which we searched for, AMP, like, fatigue, got, cold, get. So there, cold is something that's coming up hugely in our tweets, actually almost as much as fatigue is being mentioned as cold. We don't know if that's because people are feeling cold or if people are describing it as a cold-like virus. I suppose cold is a virus, I think. And in here, we've also got HTTPS and AMP, which are HTTPS as a web protocol. So this means people are putting links to things, and that's getting detected as a word. AMP is actually how we encode emojis. So those will represent emojis and links, though we can reject them later. Next thing to do is probably lowercase all the words. So if cough was the first word in our sentences, it would be capitalized, right? So that wouldn't be getting picked up now. So if we just run this, all I've changed here is I'm lowercasing the string before I do the separation. And we can see there about 200 more terms for cough have appeared in that case. So it's worth doing that. Now COVID has also shown up. So COVID wasn't even present in our top 10 before, but now COVID is our 5th most occurring word. So even without searching for COVID, just by searching COVID symptoms, we're finding people that think these symptoms are associated with COVID. And then finally, we're underreporting any words that could basically be stemmed. So we know cough and coughing are referring to the same symptom. It's just being conjugated differently. In natural language processing, there's something called stemming, where you reduce these words to their stem, which for cough, I think would just be cough. For fatigue, it'll be fatigu, because it could be conjugated as fatigue or fatigued. So it's worth merging them just to see if, we're underreporting these just because we're not merging fatigue and fatigued, cough, coughing, and coughed, things like that. So there's a stemmer that'll do that. Again, I'm aware I'm whizzing through like all of natural language processing very quickly, but it shows the difference between the word count you'll get at the start, that's just these @ symbols, and what you could get with just a little bit of tweaking. And you're welcome just to use this final one I've got here anyway. So now I can just demo. We've got fatigued will be reduced to fatigue, coughed will be reduced to cough. That's all we're doing. We're just merging all those words. So now looking at the top 50, we've merged cough and coughing. So we've got 4,000 reports of cough, though that's what we Googled. We've got headaches. We've got people talking about feeling, probably reporting how they're feeling, right? We've got COVID pretty high up, fatigue, sneeze and sneezing. Cold is almost as largely reported as sneezing is. Maybe suggests that people are talking about cold symptoms there, and that's polluting the data set. We've got sore. So again, down at number 20, people are talking about sore and throat almost exactly together. So sore throat could be a symptom that we've not searched for. There's also the word back. So maybe they're talking about sore back, but we'd have to look at it to figure that out. And then we've got anything else. We've got pain at the very bottom, perhaps another symptom, in pain, chest pain, throat pain, something like that, back pain maybe. And then all throughout this, you can kind of see people talking about things like, wearing a mask, some preventative stuff. And actually down here, we have a lot of people talking about feeling better, right? We've got good, thank, better, well. Among these symptoms, there's a lot of people saying they're better now, or trying to say maybe, don't worry, I had a cough, but it's over now. I feel much better. Things like that. Is it better on social media to come off as someone who's had COVID than has COVID? But we'd have to look at the tweets and maybe do some qualitative stuff to figure that out. I can remove those HTTP and AMPs as well. So just to visualize that, you can see cough and headache we hugely get, but that's because we asked for them. So it's not really a great visualization, but you can see how dominant those words are. COVID is showing up in so many of them. So yeah, we've seen some common terms there: cold, sore, throat, back, pain. Finally, I'll do a very quick word cloud. I'm aware we've got 2 minutes left, and I'll leave it here. So this is just a little snippet that will convert that word count we've made into an object that the word cloud library is expecting. So we get something that looks like this. Not very useful. Again, as I said before, word clouds aren't really great visualization, but I find them quite a fun way to sort of explore something, and they tend to tell quite a bit of a story, and you can sort of find your own stories in them. That one doesn't look very good, so I'll increase the sort of width, height, font sizes, and make the background white, just so it's a bit easier to read. So again, we can see in there, headache. I can see mentions of the nose that we didn't see before. So we're representing basically the top 100 words here. But we can actually see within that, people in here are talking about vaccines, boosters, masks. There's a whole connection of tweets here about people trying to prevent getting Omicron at the same time that maybe we're not reporting because so many people are reporting their symptoms, or because we search for the symptoms instead of the prevention. And then I've also included a fun little virus shape file in this, so you can mask that with the shape of a virus if you like it. But that is everything. Can we have access to the study material? Yeah, all the stuff is available on the UK Data Service GitHub. I'm linking it there. So that's particularly the health demo, and the two files you've been looking at there are the health Twark demo, which is how we grab the data, and all that cool NLP stuff is the health tidy demo. At the scraping stage, can you specify certain types of user Twitter name? I imagine, I mean, you probably can. Like if you go on Twitter and you type Joseph Allen 1234, it'll return my tweets. So I imagine there's a flag you can use if you wanted to. Who do you approach to get access to the academic API? You have to go to the Twitter developer. You search Twitter developer account, and it'll take you to an apply to access page. The process is sort of, they'll ask you a bunch of questions like who you are, what you want to do with the data, any proof of who you are as well. So if you're asking for the academic tier, they'll want a link to your Google Scholar page, or your university, if you work for one, should have a page for you set up anyway. Sometimes there's a bit of back and forth. I've literally got it before by just saying I just want to use it for a digital art project and not given any more information, and they've approved it. So they're quite relaxed, I would say, compared to other sites like Facebook. You have to have like a privacy policy. You have to have a website that hosts that privacy policy. Twitter's quite easy to grab in comparison, I would say. Would you recommend Postman? It's less intimidating for people without any programming experience. You could do, but I would suggest, I don't know. I find that personally, like API access and all that kind of stuff is probably the hardest and most cryptic part of web development. So I would imagine, getting to Postman, you still have to like paste a link in, you still have to tweak it. It does give you a little sort of interface to change the terms of those API requests. But you still fall into the same problems of, not understanding how to write your search terms and things like that. It depends. I think I would suggest, if you're struggling with it, probably go on the GitHub for Twark and tell them what your problem is and send them your request with Twark, because that's how I got to this point. They're very helpful. They know that people don't understand the API, and they will tweak it and make it easier for people in the future. Yeah, Postman is a tool designed generally for people to QA an API. So I wouldn't, this is a big frustration I have, is that there isn't really an easy way for academics to access any of this data. And the developers at these platforms go, why don't we just give them the developer way of doing it, when most academics obviously aren't software engineers, so it doesn't really work. So my plan with this is, give everybody the bits they need just to get started with it, and at least then, instead of thinking it's impossible, you can get started. Okay, I guess we're out of questions then. Thanks for having me, N8CIR.